TAEI for providing us with this opportunity to bring this case from Vellore Medical College to this platform. So this case is about a 23-year-old male with alleged history of assault with a knife by 3 known people, and the patient sustained a penetrating injury to the right side of the chest and a cutthroat injury. This happened at 9:15 a.m. on 23rd of 2023. And the patient was initially taken to the Arungalthurgam PHC at 9:35 a.m. with a bike, and he reached the PHC at 20 minutes itself, and the vitals which were recorded at the PHC were BP 160, respiratory rate was 34 and saturation was 92 in room air. The patient had a wound dressing done at the PHC and was referred to Ambur GH, which is a level 3 trauma care center, and he reached Ambur GH at 9:50 a.m. Which is almost 25 minutes from the incident time. Next. So from Ambur GH, on arrival the patient was drowsy, he was tachypneic, and the vitals recorded at Ambur GH were 170 BP, respiratory rate 42 and saturation was 90 in room air. And a respiratory examination revealed a decreased air entry in the right chest with a penetrating injury in the right chest wall. And at Ambur GH, which is a level 3 trauma care center, the patient was started on IV fluids, was given TT injection and was started on 1 unit of packed RBC blood and was shifted to GVMCH. And next. So from Ambur GH, which is the level 3 trauma care center, to GVMCH, which is the level 1 trauma care center, the distance covered was 55 kilometers, and the patient reached GVMCH at 12:50 p.m. On arrival, there was no active extinguishing hemorrhage, airway was patent and maintainable, breathing, the patient was tachypneic, and there was decreased air entry in the right side with decreased chest wall movement on the right side. On percussion, there was a dull note. So we suspected an open pneumothorax with hemothorax, and the patient was started on high flow oxygen at this point and was planned for an ICD insertion. Next slide. So a right sided ICD insertion was done, and there was 2.5 liters of blood which was drained via the ICD. So at this point there was an indication for emergency thoracotomy because a patient having more than 1.5 liters of blood loss from the initial ICD site or more than 200 ml per hour of blood drawn for 2 to 4 hours is an indication for emergency thoracotomy. So we proceeded with circulation. The patient was hypotensive and had tachycardia. So the patient was started on IV fluid rush with 1 liter of IV fluids and 1 unit of Hemicil. And a massive blood transfusion protocol was started, and in the ED itself, he was transfused with 2 units of PRBC and 2 units of FFP. And the disability revealed the patient was drowsy without any focal neurological deficit and no pupillary abnormality. On exposure, there was a penetrating injury in the right chest wall with a cutthroat injury in the anterior aspect of the neck. And an EFAST was done in the bedside, and which revealed a right hemopneumothorax, and the cardiac shadow was very equivocal. So we decided to proceed with the further imaging after stabilization. Next slide. So the initial investigations collected revealed a HP of 6.1 and hematocrit of 16.2 with a total count of 20,000 and a platelet of 1,39,000. So after the initial stabilization, the patient was rushed to the CT. In the CT, he was found to have a massive right hemothorax with a mediastinal shift and a pneumomediastinum with a right irregular cardiac border. And after discussion with the radiologist, it was found to be a right pericardial rent. Next slide. So the patient was immediately shifted to the OT, and the door to OT time was 45 minutes. So the patient was taken up for an emergency right lateral thoracotomy with a repair of right ventricular rent with a pericardial patch and the repair of the diaphragmatic rent also. In the place which is a level 3 trauma care center at GVMCH, without a cardiothoracic surgeon, this patient was operated with the thoracotomy set which was provided by TAEI at the ED, at the EOT by the general surgeon itself with a door to OT time of 45 minutes. Next slide. So the particular aim of bringing this case to this platform is to TAEI actually aims at establishing a trauma care where the patient is addressed from the site of crash till the rehabilitation, and it integrates multiple disciplines of healthcare involving various other departments. Next. So this is a statistics which states that most of the penetrating cardiac injuries are very rare to be encountered, with an incidence of almost 0.1% of the total trauma cases. But the mortality is as high as 85%, and most of the patients crash before they even get to arrive to a definitive care. And next slide. This was the patient. He was later continued with the massive blood transfusion protocol and was shifted to a surgical ICU, and he was rehabilitated and later came to OPD review and ED to just for the follow-up, and he was doing well. Thank you, sir.